Assalamu alaikum, dear students of Bashundhara Ad-din Medical College, BAMC 7. Welcome to my class. I am Professor Dr. ABM Omar Faruque, Professor and Head of the Department of Anatomy, Bashundhara Ad-din Medical College. Today our topic is the tongue. Tongue is a hollow conical muscular organ situated in the floor of the mouth. I repeat, tongue is a hollow conical muscular organ, situated in the floor of the mouth. There is a synonym of tongue, synonym, another name, lingula, linguli, or lingua, variation, but there is a synonym, you should know it. In picture, you can visualize the scenario of tongue, macroscopic structure of tongue. Now, parts and other topics of tongue. Tongue has three parts. Tip, body, root. Tongue has three parts: tip, body, root. In some author, tip is called apex. Apex, body, root. We can say tip, body, root. Two surface: ventral surface, dorsal surface. So, which surface we can say? Just open the mouth. This surface is called dorsal surface. The under surface is called ventral surface. Two surface. Then two lateral border. You can say two lateral border or lateral margins. Some authors say lateral margin. Two margin or two borders, three parts, two surface. The tongue is attached or related or merged with oropharynx by two fold. Medially, the median glossoepiglottic fold, you can visualize in picture, median glossoepiglottic fold, and laterally lateral glossoepiglottic fold in both sides. You can see median glossoepiglottic fold, lateral glossoepiglottic fold. This space, this gap, space, depression area is called vellicula. So, root of the tongue is depressed, it is called vellicula. Now, dorsal surface of the tongue. This you can visualize the picture in dorsal surface. Dorsal surface's tongue is grossly subdivided two parts, anterior 2/3 and posterior 1/3. And there are some another part, this is called extreme posterior or most posterior part. So, anterior 2/3, posterior 1/3 or most posterior part. There are some characteristics feature in different parts. Anterior 2/3, it is rough due to papilla. Anterior 2/3 is rough due to papilla. Examiner will ask you which surface is rough. You should say dorsal surface. Why it is rough? Because anterior 2/3 is filled by papilla. Then posterior 1/3. Posterior 1/3, it is also rough, but it is not due to papilla. It is due to lingual tonsil. Posterior 1/3 is rough due to lingual tonsil. Submucous lymphatic follicle present in tongue. Tonguer mucous membrane under mucous membrane niche ba under surface of mucous membrane there is a lymphatic follicle, which is called lingual tonsil. In next class we will learn types of tonsil in oropharynx: palatine tonsil, lingual tonsil, tubal tonsil and pharyngeal tonsil. This lingual tonsil is present in tongue. So, anterior 2/3, posterior 1/3. Now, we are in papilla. What is papilla? Papilla is a projection of epithelium with lamina propria. We know that any structure is lined by epithelial tissue. So, tongue is also lined by epithelial tissue, something epithelial. So, projection of epithelial with lamina propria is called papilla. Papilla is 4 types of papilla present in tongue. 4 types papilla present in tongue. Number 1, valate papilla. Valate in front of sulcus terminalis. You can see the picture in front of sulcus terminalis. Velvet papilla. Sulcus terminalis is a V-shaped demarcation which divide the tongue anterior 2/3, posterior 1/3. This is sulcus terminalis. In front of sulcus terminalis, there are some papilla, 8 to 10 papilla, large papilla. In right picture, you can see the histological picture of velvet papilla. Above one is velvet papilla. Number 1, foliate papilla. Number 2, foliate papilla. Foliate. Lateral margin of the tongue, it is present. Foliate. Number 3, fungiform. And number 4, filiform. Filiform is numerous. Lot of filiform papilla present in dorsum of the tongue. Filiform, numerous. Lot of. So there are how many types? 4 types. Velvet, foliate, fungiform, filiform. Now muscles of tongue. Previously I have discussed tongue is a hollow conical muscular organ. So obviously there are some muscles present in tongue. These are voluntary muscle. All are voluntary, and histologically they are skeletal in nature. Skeletal muscle. So which type of muscle present in tongue? You must say skeletal. I mean voluntary. Controlled by your will. Voluntary muscle. These voluntary or skeletal muscle are in 2 groups: extrinsic muscle and intrinsic muscle. Extrinsic, intrinsic. So extrinsic muscles are 5 pair, intrinsic muscles are 3 pair. Extrinsic muscles, why it is called extrinsic? Have you any question about extrinsic? So extrinsic called, it arises from outside the tongue but inserted in the tongue. Outside the tongue there are some bones, mandible, palatine bone, styloid process of the temporal bone, and etc. This muscle arises from that bone but inserted into tongue. This is called extrinsic. Number 1, healthy bulky muscle is called genioglossus. Genioglossus is the heaviest, bulkiest muscle among the extrinsic. Subsequently, we will discuss the functions and role of extrinsic muscle in tutorial classes. Okay. Then intrinsic muscles. Intrinsic muscles are transverse, longitudinal, transverse muscle, longitudinal muscle, and they are called intrinsic because they arise from tongue, insert into tongue. Arise from tongue and insert into tongue in median raphe. Now most important and valuable question for examination: nerve supply of tongue. Nerve supply, very important question for exam, also for your perception. Nerve supply. Tongue is consist of voluntary muscle, so its nerve supply is somatic, always somatic. Somatic means motor and sensory. So first one, motor. Motor means it gives motor supply to its muscle. So you can summarize, you have to summarize the nerve supply of muscle, tongue, motor. All the muscles of tongue is supplied by hypoglossal nerve. I mean 12th cranial nerve. All the muscles of tongue is supplied by hypoglossal nerve except palatoglossus. Previously I have delivered the on pictures and theory in your messenger group last night. I think you have already received some information about motor supply. All the muscles of tongue are supplied by except palatoglossus, which is supplied by cranial root of accessory nerve. So the basic information, there are 2 motor nerves involved for nerve supply of muscles of tongue. 2 motor nerves, 11th and 12th. Am I clear to you? 11th and 12th. And next, sensory. So sensory is for only epithelium. Epithelium supply, epithelial lining epithelium receives sensory supply, sense. So There are multiple nerves involved in sensory supply. There are two types of sense, general sense and special sense. General sense means pain, touch, temperature, hot and cold sensation. It is called general sense. Special sense for tongue is for taste. Taste spelling is always randomly mistaken by the medical college student. Taste means T-A-S-T-E, taste, not T-E-S-T. T-A-S-T, taste. Special sense means taste system for tongue. So, there are multiple nerves involved in sensory supply. You should go through the book and my lecture note. Finally, functions of tongue. Is tongue serve any purpose to our body? Is tongue serve purpose to in our body? Obviously. Tongue is a voluntary organ, but in Viva exam, tongue is involuntary. In Viva exam, tongue is involuntary, but tongue is a voluntary structure. In Viva exam, tongue in. But one author said, a 6-inch long tongue can even kill a 6 feet height man. Do you understand this message? Yes. A 6-inch long tongue even kill a 6 feet height man. Open fire, guli hoye gelo, kill the patient. Tongue is used for. So, tongue deserves the highest diameter of brain area. Motor area te tongue er jonno sobche beshi jagah rakha ache. Amra egulo brain and CNS and I bole porbo. But functions of tongue. Number 1, taste. Number 2, speech. Number 3, deglutition. Number 4, mastication. Number 5 also helps in swallowing. Among these 5 functions, which one sensory, which one motor? Can you identify? Only taste is sensory, all our functions are motor functions. Main function is speech. We cannot talk without tongue. Clear? There are some clinical correlation of tongue. There are some clinical value. Infection or inflammation of the tongue is called glossitis. You should go through this these topics. Glossitis. And finally, tongue is a mirror image of some disease of GIT. Tongue is a mirror image of some disease of GIT or alimentary system. Mirror image. I mean, you can just guess or you can just think preliminary information about the tongue, about some great disease. Tongue থেকে আমরা কিছু কিছু disease অনুমান করতে, we can guess like dehydration, anemia, jaundice, cyanosis. Dehydration, anemia, jaundice, cyanosis. These 4 diseases you can primarily guess or judge from tongue. That is why it is called mirror image of some disease. There is a clinical question asked by the examiner or set it in SEQ. You know the tongue is motor supply is hypoglossal nerve. Examiner will ask you, if right hypoglossal nerve is paralyzed, what will happen to the patient? If left hypoglossal nerve is paralyzed, what will happen to you? There is a question, clinical question, problem based question. If right hypoglossal nerve is paralyzed, what will happen to you? What will happen to the patient? Just say, just listen to carefully, listen to me carefully. Right hypoglossal nerve supply left hypoglossal nerve, but if right hypoglossal nerve is paralyzed, this role is avoided. তোমরা একটু আগে বলেছো যে right hypoglossal nerve is give supply to left half of the tongue. It is a role, but in tongue it is not maintained. Right hypoglossal nerve do not cross and directly supply to right side. Left hypoglossal nerve do not cross, directly supply to, and obviously genioglossus muscle. Genioglossus muscle function holo protrude the tongue, protrude the tongue. You can protrude the tongue, just come out from your mode, protrude. Genioglossus muscle function ki protrusion of tongue. So if right hypoglossal nerve is paralyzed, so genioglossus will be paralyzed. So genioglossus cannot protrude. So right side hypoglossal nerve jodi paralyzed hoy, if right sided hypoglossal nerve is paralyzed, right side will be weak, left side will be strong. So left side hypoglossal nerve will unopposed action will pull the tongue in left side, but paralysis is right side. So tongue is deviated to healthy side. যেন মনে হবে left side paralysis হয়েছে, but clinically right side paralysis, but tongue is deviated to left side, healthy side. Am I clear to you? So my right hypoglossal nerve is paralyzed, tongue will deviated this way, because on that condition left will be all in all. Left will pull the whole tongue left side. যেন মনে হবে easy if it seems to be left side paralysis, but paralysis is right side. Am I clear to you? Last topics. There is a common congenital anomaly of the tongue. It is called tongue tie or ankyloglossia. Very, very important for written exam, also for embryological question. Tongue tie or ankyloglossia. You know the tip of the tongue is attached to the floor of the mouth by frenulum. This is called frenulum. Frenulum দিয়ে tongueটা floor of the mouth আটকানো থাকে. If frenulum is short, it is called tongue tie. It is a congenital anomaly of tongue where frenulum is short. It is a common congenital anomaly of tongue. Other name ankyloglossia. Am I clear to you? This is the principal's information about tongue. There are some accessory information, some picture, some drawing level, and some cross section study. You have to overcome, you have to summarize, you have to cross in tutorial classes. Okay, that's all my information about today's class. I hope you have enjoyed my class. Thank you for patience and cooperation. Thank you again. Assalamu alaikum.